Hi, Dr. Pelto here. Welcome to Podiatry Practice Mastery. Today I am going to go over what I promised last week. I'm going to go over the 4 misconceptions of having a profitable practice and going 10x. So what are some of the misconceptions that people have about having a profitable practice and being a profitable practitioner? And this is more for your individual production, not so much for the whole office of all the doctors, because you can only work on yourself. You can't really work on others. And then if you stick around till the end, there's a special bonus I'm going to talk about. Okay. So misconception number 1 about going 10x is I have to see tons of patients. This is a misconception. I know some doctors, they pride themselves on seeing like 40 or 50 patients a day. And the only way I can do that is if I'm seeing routine care. And then I'm seeing, let's say I'm double booking them like on the hour or on the half hour. So the way I tend to do it is on normal days, I see patients every 20 minutes. So that would equate, it's obvious, but you can do 3 per hour. You don't have to add, I don't have to add for you. And I don't see a ton of patients. I think 20 minutes is adequate for new or established patients. Occasionally, if I'm doing a procedure and I need more time, I'll put it right before lunch, or I'll put it at the end of the day so I have a little bit more time at the end. I do not tend to double book. Occasionally, what I do now, because I have a scribe, is I'll double book. I'll put it like a double booked appointment, like a paronychia follow-up as a quick one. So it'll be a quicker paronychia follow-up. So you don't have to see tons of patients to produce revenue. What you have to do, like we talked about last on the last recording, the last weekly update, was you have to be more comprehensive with our patients. So with that 20 minutes, you have to talk about what's most profitable. So I don't think tons of patients are necessary. I usually see about 24 patients on a day. And then on routine days, I might see about 40. So I do a routine block on Fridays, and then I tend to double book them. That's where I'm doing my teeing people up for a comprehensive diabetic foot exam or a pad net or things like that. And I'm seeing a larger number of patients that way. Okay, so I don't think you need to see tons of patients. I know there are certain groups that want to see tons. I don't think they're producing as much. I don't think they're producing as much in terms of procedures or in terms of revenue, or even giving them the best patient experience. That's my opinion. The second misconception, and I think some people think, well, the practices that are producing, let's say the doctor's producing over $1 million, they're saying, well, I think they're being untruthful. And I don't think anyone, that's the misconception. I have to be untruthful. And I don't think that's right. I don't think you have to be untruthful. You have to be honest with our patients, but you have to be smart about it. You have to offer what's going to produce greater value for your practice and also for the patient. I think it's actually the opposite, because if you're untruthful, they're going to talk to each other. They're going to be upset with you. You're going to have bad reviews and things like that. So being untruthful, like for example, untruthful in how you're billing and coding, that's not going to work because you're going to get audited. It's not worth it to code things incorrectly. I want to give you an example. In terms of nails, some people call everything a paronychia, even when there's no signs of infection. But I have a separate, I'll do like a partial nail avulsion if there's no infection. And then if it's an infection, I'll do incision and drainage code. Even though incision and drainage produces more, right? I'm not going to do that every single time, even if there's no redness or signs of infection or things like that. Another example would be a porokeratoma. You can use a lesion destruction code. I'll do that like once a year, but I'm not going to do that every 3 months when they come in doing a lesion destruction. I don't think it's appropriate for that type of a procedure. So certain things you don't have to, you shouldn't be untruthful about things. I know some people, they call all nails debrided, and when they're not thickened, and I do not do that either. Okay, so things like that, you don't need to be dishonest. What you have to do is learn to recommend what's better. You have to get better at being a better doctor at recommending things. Like when orthotics are beneficial, would they benefit a patient and offer them to patients? Or AFOs are beneficial, or amniotic injection would be beneficial, or shockwave. These things that produce more revenue, you have to be better. You don't have to be less truthful. I just want to really clear up that misconception. I think some people think of that. Now, if there are people that work with you or have trained you or you see around that they are untruthful, I would not shadow after them or model after them, because you're going to lose sleep at night doing it that way. Misconception number 3 is I have to do everything. I think this was a big area that I made a mistake in the past. Specifically, if I could do one thing over again, I wouldn't have waited so long to get a scribe. Okay. I always thought, because I thought my partners they're not using scribe, so I can't use a scribe, or and I have to just be more efficient. And I was very efficient at my notes. I was very efficient at my EMR, and I use Athena. All the templates are set up, but I was doing everything. I was treating the patient, then I was going back and I was doing the notes as well. And it just kind of got me mentally fatigued from that constant back and forth, that constant multitasking. And so you don't have to do everything. What you have to do is what you're really good at. And I found the best thing to delegate was my notes. Because I could be more present with the patients, I think I added one more patient, or maybe two patients, like quick paronychia follow-ups. I added 2 to my slots, but I didn't really change the slot of time. But I thought I could be much more comprehensive because I was present with patients and I wasn't always distracted. So the combination of using a scribe and also using my presentations, I could offer much more to the patients. I could spend more time talking about what they needed, what them help get them better, versus doing my notes. And I was trying to do my notes in the treatment room or staying a lot later with that. So that's one thing. Another thing is having confidence in my staff and training my staff. So so some things, like I still do my own cortisone injections or shockwave and injecting up toes. I know some people delegate that. I know some people, they train their staff to do shockwave. And for example, if we're doing bilateral shockwave, and we can use, like, say, the radial on one foot and the focused on the other, we can then train our staff to do one while we're there. That's one option. I know other people, they hire personal trainers to do the shockwave, or other types of professionals, so they don't have to see them to do them. You can hire certain technology to do it for you. For example, if you're doing laser for toenails, I have kind of limited belief in that, but we do have a Lunula, so it does it on its own, versus the Cutera, where I had to do it on my own, the Cutera laser, which I used to use. Now we have one where they can just put their foot in that little box. And so kind of ways of not having to do everything. Also, in terms of typing, when I was used to doing my own medical notes, I used to have a lot of templates set up, so I didn't have to type everything out every time. So I set one up, made a macro for it, and it made it a lot easier. And so you don't need to do everything. As much as you can delegate to staff, we try to delegate common answers that you give, giving them permission, giving them the ability to set up and make decisions on their own. Like another thing I do is I have my staff do Una boots. I'll have my staff do cutouts for cam boots for ulcers. I have the staff, as much as I can have them do, I have them. But really, if you're going to start with one place, I would recommend start with the scribe, because it can really free you up much more, if you're busy, because it can free you up to see more, not just see more patients, but be more comprehensive in the care that you're getting them. Okay. And then the last misconception is misconception number 4. I have to treat every condition. And this is, I thought in the past it was true. So when I first started out, I thought I had to do everything. I had to do the closing base wedge osteotomy. I had to do all the lapidus. I had to do all these things, which I wasn't really trained great in at my program. I want to be clear. And you don't have to treat every condition. You don't have to do everything. You can give those to other people that do a lot more of them. We have a doctor in the practice now. He does a lot of the midfoot fusions and midfoot work and rear foot. And I'm happy because they're getting great care, and I can send them over, and I don't have to do it because I don't have to lose sleep, because I wasn't the best at doing it. Okay, that's the reason. And so you don't have to treat everything. And once again, if you're not treating everything, you can give it to someone that is treating it well, and you can focus on what you do well. So for example, my colleagues, they'll send over to me stuff like the Cariflex for these ugly toenails, or the Onifix for ingrown toenails, or they'll send over biopsy. There's dermatologists that send over possible melanoma on the toenail, these dermatological things that I like to treat. And then I'll send other things over to them that I can't get better. So you don't have to treat everything, but focus on the things, once again, that produce more revenue. That's the misconception. I have to treat everything. I have to treat everyone that comes in. One way that we've made it helpful not to treat everything is, for example, with routine care, we do block time. So my block time is Friday, and that's the only time that they can see me. My other buddy is on Thursdays, and my other colleague, he doesn't see any of it. And so having it kind of restricted, that access, makes it a lot easier for us not to be available. So if there's times where you don't want to do something, you just limit the availability. Like I only do it on Fridays. So if they can't do Fridays, they can't see it, they have to find someone else. So for certain things, you could do that, limit your availability, or you can give it to someone else to do as well. I don't think it's good just not to see them back. I know I hear some people around, they just say, the doctor said they can't do anything. I don't feel comfortable just saying, hey, I can't do anything. I like to at least try to help the patient. So those are the 4 misconceptions. So misconception 4, I have to treat every condition. Misconception 3, I have to do everything. Misconception 2, I have to be untruthful. And 1 is I have to see tons of patients. What we are going to go over on the next weekly update are the 5 tips to get abundantly more done and in the same amount of time as you've currently been using. So how to get abundantly more things done next week. Once again, I have a special offer I'm going to be putting here underneath this video. It's a special intro offer to the Practice Mastery Academy. If you haven't heard of it, I would recommend you join. I can't make it really decision proof. It's real inexpensive. You just kind of go down there, click the link, and you'll get 2 months basically for free with all the bonus content that you're going to be getting there. So I'm going to put that link. If you haven't joined the Practice Mastery Academy, I put everything in there, and then all of my monthly master classes all go in there. So it's all a matter of you kind of using it. So I'm putting that link underneath this. Great. Until next week, we'll talk more. Okay, thanks.